remarks. Now we are live. Okay. So, good namaste, friends, colleagues, social work scholars, and the practitioners. At the outset, I must thank each one of you for taking out your time to join us today. Your presence reflects the shared commitment of our community of social workers to this thoughtful dialogue on the future of social work education and practice in the light of this new development about the curriculum released by the National Commission for Allied and Healthcare Professions. It is indeed my pleasure today this discussion, which has been titled as Decolonizing Medical and Psychiatric Social Work. Why should the concerned ministry rethink the task force curriculum? As we engage with this draft curriculum, our aim is not to dismiss the effort that has gone into this work, but to examine it critically and constructively, whether the proposed framework aligns with the professional, pedagogical, and contextual realities of social work education and practice in India. A careful reading of the curriculum reveals a number of analytical concerns that will be discussed intensively in the due course, but a cursory look will show that the curriculum draws extensively from the global allied health, but offers limited evidence of being anchored into India's social work traditions, institutional diversity, and community based health experiences. The framing of the curriculum tends to squeeze general social work primarily within medical and psychiatric social work, and the standardization and the technical density of the curriculum raise questions about its feasibility across the wide spectrum of Indian universities and the field institutions. At the doctoral level, the guidelines which are given in the curriculum appears to offer relatively limited space for the Indian theoretical framework and the context-sensitive methodologies prevailing across the Indian diverse society. Taken together, all these observations suggest a need to reflect on whether the current draft adequately captures the realities of India's health sector, the intellectual evolution of social work education in India, and the capacities of the institutions expected to implement this curriculum. Today's conversation, therefore, is not about critique for its own sake, but about identifying where the curriculum aligns with our professional needs, whether it diverges or whether it may benefit from rethinking, restructuring, or deeper contextualization. Our panel today will help clarify how the curriculum might evolve to better reflect the Indian context, strengthen disciplinary identity, and serve the future of social work within the larger generalistic practice vis-a-vis the health sector. Our colleague and senior academic, Professor Kanagraj Ishwaran from the Mizoram University, who is known for his critical engagement with the issues of Indianizing of social work curricula in India, will in his presentation deliberate on the following broad issues. To what extent does the curriculum reflect the realities of Indian health systems, government hospitals, of this curriculum? Another important issue where Dr. Kanagraj will be touching upon is that how effectively does the curriculum preserve the distinct identity of social work as a social science discipline within the health sector, rather than positioning it primarily into an extension of the clinical settings. I expect Dr. Kanagraj will also be, dealing with the issues of global competency-based models used in the curriculum adequately calibrated to Indian pedagogical traditions, institutional capacities, and fieldwork environment. So all these gaps in the curriculum design and the India's socio-health realities and what other elements require rethinking and restructuring will be dealt in today's discussion. And this discussion along with me will be facilitated by one of our senior friends and colleague from University of Delhi, BR Ambedkar College, Professor Vishnu Mohan Das. He will also be giving his valuable input in the course of the discussion and will be facilitating this this deliberation as and when he feels like. So this is open for every one of the audience also, as and when they feel the need of an interjection, they are most welcome to raise their queries and questions in the chat box, and they will be accordingly be will be answered to the best of the understanding and the ability of the panel experts today on this platform. So without being between the audience and our friend Kanagraj Ishwaran, I would now hand over the proceedings to him for further deliberations as he deems appropriate. So over to Dr. Kanagraj, please.
Namaste, Professor Dharampal Singh, my dear friend, Professor Vishnu Mohan Das, dear all. We are in a very significant historical juncture. After nearly 1 century, social work is going to celebrate a century of existence in this country. We have not become a profession, a full-fledged profession in India. And we are not thinking why. We are not seriously deliberating upon this core issue. Why social work has not become a profession in India? Why social workers have not gained adequate prestige, respect, position in the society, their living conditions or job satisfaction far from our satisfaction. We know very well, though we are in academic, we know that the condition of social workers, living conditions of social workers, life satisfaction of social workers are far from our satisfaction. Social work has not become a profession and it has not got integrated into Indian society. As the advocates of bar, we feel that it remains alien to India's culture, civilization. Its agenda is continuing to serve the colonial masters, erstwhile colonial masters. The social workers, so-called professional social workers trained in social work education, educational institutions across India, they are culturally disconnected. They are not able to understand our realities, our problems from our own angles and provide help, support to address them. So that is the main reason. And national education policy is a boon for all of us who have been advocating for Bharatiya. Bharatiya movement is addressing this serious issue. Social work to get rooted in India, it should integrate Indian knowledge systems. It should shed its colonial and imperialist vision of destroying other cultures, civilizations, and promote Western worldview, culture, cosmology. So that is our vision of Bharatiya. Bharatiya wants to integrate all Indian knowledge systems, not only Indic knowledge systems, all the non-Western knowledge systems also which are useful to us. We don't accept the exclusive hegemony of the West, which we believe that is causing alienation of social workers, professionally trained or qualified social workers from Indian society, and we remain outsiders of Indian society. So that is our mission. Our mission is to integrate, to demand and acquire adequate and fair space for India's knowledge systems. This National Council for Allied Professions, Health and Allied Professions came, we are all very happy because at least one or two specializations of social work have acquired allied status, allied professional status. And this commission has appointed a task force to prepare a curriculum, a competency-based curriculum for psychiatric, medical, and clinical social work. And it included, it comprised of 15 members drawn from psychiatric social work, medical social work, public health social work, and they are from NIMHANS, TSS, LGBRIMH, EBAS, AIMS, PG, IMER, RINPAS, IMHANS, and some universities, TISS. And if you could see, TISS got 2 representatives. LGBRIMH had 2 representatives. Delhi, again you could see strategically locating it. Delhi, EBAS, Jamia Millia got 2 representation. Bombay got 2 representation. So what we see is in the composition itself, elite domination is there. Then the mandate is to draw the curriculum for social work discipline in the health sector. And the task committee has also responsibility to provide policy directions. And it is expected to reach a consensus on nomenclature, the concepts related to health. And they worked as 3 teams, 3 subcommittees for developing undergraduate, psychiatric social work, medical social work. Like that, they have developed a curriculum. And they have come out with a standardized nomenclature, curriculum structure, career pathways nationally. And they claim that this curriculum is this curriculum constitute a paradigm shift from didactic to competency and outcome based education in social work. And they also claim that this curriculum addresses the health inequity and inequalities in the healthcare delivery. And they also hope that this will promote human resources or workforce capable of integrating psychosocial care into care system, maintaining accountability, innovativeness, and scientific tools. That the expectations, the promises. We can say that they are hoping that if implemented this curriculum, they have provided a curriculum structure, Bachelor of Medical Psychiatric Social Work, specialization at bachelor's level itself, 4 years bachelor's degree, and 4 years after that they branch out medical in 4-year bachelor's degree, medical and psychiatric social work together, and after that medical work, psychiatric social work separate, 2 years master degree, and then PhD. For all the programs, PhD, medical social work, psychiatric social work, UG degree in medical and psychiatric social work, 4-year degree. They have proposed curriculum. So this curriculum, actually, it has, the committee, task force committee has come out with a curriculum structure which is parallel to the existing UG, PG, PhD curriculum structure. What we have at present is that actually these institutions, NIMHANS and NIMHANS, other institutions, EBAS, RINPAS, all these LG, Lokapriya Gopal Bharadwaj Regional Institute of Mental Health, which is in Tezpur in Northeast India. These institutions were offering an MPhil program after post-graduation. Now I had conversation with some of psychiatric social work professors. They are not going to offer UG degree in psychiatric social work. They will be offering only 2 psychiatric social work degree only. After UG, students will be admitted there. So this is a parallel structure, parallel curriculum structure. UG, PG, everywhere, a parallel structure they want to build. Probably what I feel is that this core BSW curriculum will be adopted by medical colleges or private institutions, missionary institutions which are running medical colleges. They will offer these courses, BSW, medical social work, psychiatric social work, PG courses, PhD courses, like that. PhD courses, of course, will be offered by these national institutes, no problem. So this is the curriculum structure. How are we going to analyze? How are we going to look at? What is the lens we are going to do? We are going to use a decolonization lens, Indianization lens, non-westernization lens. That is what we are going to use. What we are going to see is that the curriculum provides adequate space to non-Western people, non-Western cultures, knowledge, curriculum content, whether adequate space is there, whether references include, in the references there is adequate space to India from our point of view. Then when we look at curriculum goals, what is their motivation? I said social work is working in India as agency of Europeans, colonialization, agency of imperialism, promoting Western ways of thinking, living, believing, valuing. So social work in India is an agency. Social work in India was introduced by missionaries for proselytization. To the mission of social work was not only all over non-Western world, was to legitimize the colonialism, the European domination, to say they were inferior intellectually, spiritually, morally. The non-Western peoples, Indians, are inferior. Macaulay. So what you need to do, you need to give up all your values, beliefs, life, everything you have to give up. What you need to do, you have to follow the West. You have to become like the West. So this is the agenda of social work when it was introduced in non-Western countries. And this agenda continues even today. Now we want to see whether that is there in the curriculum. Such a tendency is there in the content, references, ultimately in the curriculum goals. And how does it see social work? And how does it understand India? What is the lens you are legitimizing social work? And how whether they are looking in as a culture, civilization which has contributed significantly to global knowledge. So whether understanding is there in this curriculum, or whether there is adequate space for India. We cannot accept that India cannot think, Indians cannot think. Our ancestors were fools. Britishers have civilized us. There is one theory is that why West has colonized India and other non-Western people? Because uncivilized savages. So your knowledge is waste. All your libraries are waste. Superiority. Macaulay says, all whatever you have, maybe volumes of literature, all are wasteful. One library is not, literature is not equal to one library in the West. Whether such a belief is there in this curriculum, that's what we are going to see. We have seen, and at the, I am saying in the outside itself, I am saying, yes, it is there. This is part of this particular curriculum, is part of Western mission, destroying India's culture, civilization, and knowledge systems, replacing them with all the Western ones. Already they have destroyed many cultures all over the country, all over the world. It is fact. In Africa, in America, work wherever, it legitimized those efforts. And now also legitimizing all this and this curriculum. Let me show one by one. One by one I will show. First part. What we have done is that we listed all the theories. What are the theories taught at the BSW level, medical, PG, medical social work, PG, medical social work, PhD, medical psychiatric social work. So when we see micro, meso, macro, multi-level methodological levels, you could see in BSW level, you could see macro perspectives. systems change, structure change, social change approach, those approaches dominate. And you could see medical social work also it dominates. In psychiatric social work, micro level interventions dominate. In PhD level, you could see there is a little more balance between macro and multi-level interventions. Methodological contents are gaining much more. So when you look at as a whole, there is no linear progress. See, medical and psychiatric social work is supposed to primarily with the micro level and meso level. I'm not saying macro level not needed. Macro means national level. Communities, organizations with medical and psychiatric social workers need to be prepared to engage with the micro level. That means working with individuals, families, and groups. Then working with communities and organizations. What are they preparing for? Macro level, change national level. Whether individuals, social workers are equipped to change macro level. I am not saying we should not know. See, meso level is actually ignored. BSW level itself, macro level. Again, MS Gore suggested social work should focus on macro. IFSW is saying it should focus on macro. And again, macro, national level only, global level. India has become poor. Non-Western countries have become poor because of colonialism, colonial plunder. This is hidden. See, that attention is diverted towards national level macro factors and ignoring the global power inequalities. In international social work also, Western social work literature also, the colonialism as a factor of inequality, discrimination, racism, oppression, underdevelopment in the non-Western countries is not recognized. See, again, the perspective is very clearly, by bailing out the atrocities of the West, plunder of the West. No, the non-Western countries, people became poor because of the colonial rule and continued hegemony of the West. Even today, the global thing, global market, the global political economic order, the domination of the West is contributing to the impoverishment. And again, the intellectual domination in the academia, the Western domination in the academia is sustaining the global political economy. So this overemphasis on macro, even at the BSW level, shows Eurocentric bias, and it is an attempt to sustain the hegemony of the West. And again, now one more thing. There are different theoretical perspectives, concepts. We have listed all the concepts, theoretical perspectives, models, and counted. You may ask, how can you count such a document? That is all old way. Now we can use AI to list all the theories. You can yourself do it, verify my claims. LM note, Google LM note is there. With the help of that, you can list out, you can ask questions. This AI can help us to count and then again classify, then tabulate also other tools. So with that, we classified the theoretical perspective into Western, non-Western, and Indic. When we see as a whole, predominant majority of the perspectives from the West only. Indian, very rare. And that also not the level of theory, perspective, model, but just for policy, program, legislation. And now NEP says it needs included to supplementing, complementing, to legitimize these Western models are included. So the very, very clear, they have not tried their level best to search for what is available here. They have tried to impose all the Western ones as much as possible. This kind of there when we see the overwhelmingly Western content, theory, paradigm level, you could see marginalization, token inclusion, just namesake, Ayurveda is there. Not all eyes together as supplementing, complementing the Western models. Indian thought, Indian philosophy gives very deep, holistic understanding of well-being. Ayurveda, Siddha, Unani, though homeopathy is foreign one, it is also providing holistic understanding of health and mental health. See, the core understanding of health and mental health well-being, which are the focus of social work and medical health and mental health social work, our knowledge systems are not included. Yoga, Sankhya Yoga model, Vedanta Mimamsa model, all are dealing with Sukha and Dukkha and Moksha. I have been telling this from time to time. So they are giving the allopathic understanding. And in clinical psychiatric social work, the Western models are more dominant. And there is no epistemic diversity in knowledge. All they talk about pluralism, culture, all those things, cultural humility. Now they talk about cultural humility. And the word civilization is not there in the course of sociology course. Without studying culture, civilization, its components, and understanding Indian culture, what is it and what are the important features of Indian culture, they want to respect Indian culture and they are cultural sensitive. How come you be sensitive when you read only the Western one? When you look at from the white point of who killed, who destroyed, who robbed the knowledge systems of the way India and other non-Western people, and from their perspective, how can you understand? See, this is very serious problem. And it is not that we don't have very rich knowledge systems which are useful for promoting well-being, holistic well-being and health. Ayurvedic models of health is there. Tridosa. Is there? Tridosa model is there. Why not you discuss? It is India. It is not America. It is not Europe. We have not become other. We have not got culturally uprooted. See, they cannot deny space for Indian knowledge systems. And we know the time is different. We know that knowledge. We no longer believe. You people, the elites, you should know that you should respect India's knowledge systems and India's contributions to the global knowledge, especially to well-being, wellness, and health. You cannot deny the space for. And again, coming to another classification, we have again classified these theories into evidence-based and non-evidence-based. Why this classification? Many a times we believe that Western models are evidence-based, tested, validated, which is not true. Western social work models, social science models are not necessarily testable in the first place. I am not saying that, and they are not open for debate also many a times. They are not ready to discuss anything with us. They are not ready to debate with us. So this is the problem. And when we classify this, most of the perspectives again are non-evidence based. You could see, but when it comes to PhD level, somewhat declining is there. Because methodology, all those things are there. The non-evidence based, and these models were not even tested in the West. What our Acharya S.N. Balagangadhara says is that social science models, theories are secularized versions of theology. When I looked at the history of social work, I found that social work itself is a secularized missionary work. And we see the models which are not testable, tested, not open for debate, they are dominant in the curriculum. See, this is actually indoctrination, imposing the Western beliefs, whatever they think. These are the theological oriented models, and this is not desirable. This is desirable for social work. And they may say that you are saying Ayurveda and all our models are testable, open for debate, already debated. Our Pramana model is an alternative to the Western model of science, and our sciences are holistic, integral, to borrow the term from our Acharya Sri Aurobindo. Later, Din Dayal ji has used integral humanism. Nana ji has demonstrated its effectiveness in community development. Next level, still deeper ideological level. What are the ideological orientations of these perspectives? We know that theories have ideological underpinnings. We have done analysis of these theories, classifying them into conservative, liberal, radical. When we classify, here liberal perspectives dominate at all levels. And there is a substantive conservative perspectives also, which status quo is perspective also. And not only that, the radical content. What is radical content? Some critical theory, Gramsci, all those perspectives which are aggressive. You could see in India, they developed two models, Dalit and tribal social work. Just changing the name only. Critical social work, they have changed it. The scheduled caste, scheduled tribe got affected due to colonialism more than anybody. The famines, droughts created by the British unrule affected the poor most. And indentured labor affected our people. All that experiences, these experiences, colonial experiences, are not included in the Dalit and tribal social work. And it is legitimizing Euro intellectual domination. So when you see radical perspectives are dominating, and they are not suitable. They are not suitable for social work. And they are suitable for Naxalites. By increasing models, what are they trying to achieve? Making social workers. Are they making social workers or Andolan Jivis? Social workers not become Andolan Jivis. We cannot become Andolan Jivis or proto-Naxalites or Naxalites in professional garb. Social workers need to become professionals, and we are professionals to earn our livelihood. And we cannot, if we, these Naxalites, these mercenaries, Andolan Jivis are working for America, other foreign countries. They are trying to generate revolutionary rebellions that happened in Bangladesh, Nepal, Sri Lanka, like that. Paid revolutions they want to create here. And for that, social work, why should social work for that? Social work education is meant for creating urban Naxals or Andolan Jivis. And this much content and content is not there in the contemporary medical, psychiatric, social work curriculum in NIMHANS or any other institutions. And two people have come from TASS and they have dominated the curriculum designing. And they have brought all these radical pseudoscientific anti-India content. And when they teach these curriculum, these models, they never criticize. Uncritically imposing Western models, that also radicals. And nobody can deny that this Naxalism and these radical perspectives are different. They are same only. In Swarupa, in essence, intrinsic characteristics, they are undemocratic, they are aggressive. Wokeism, we call wokeism today, which is destroying our families, communities, cultures. This is the tendency, that radicalization tendency that is dominating and that has come from TASS, Delhi school curriculum. In macro level, I said macro level, micro level, meso level. In macro level, they include other perspectives, structural functionalist perspective, general system perspective, all that they exclude. Only they bring radical perspective to the maximum extent. One thing you may wonder, they have brought in E.V. Ramasamy Nayakar, non-Brahmin movement in the country. E.V. Ramasamy Nayakar was one person, one political leader who opposed India's freedom. I am from Tamil. I know very well the history. And along with Gandhian perspective, non-Brahmin perspective, like that they have included all the anti-India arguments and India's culture, and there are ideologies, perspectives, India's culture, civilization, all they are called Breaking India lines by Rajiv Malhotra and Aravind Nilakandan. And all the fault lines are included in this curriculum. This curriculum aligns with anti-national agenda of the West. And it seems many sipais of the West wants to promote national disintegration are connected to this curriculum. So this is very dangerous tendency. Wokeism, they try to make social work curriculum woke. And again, when it comes to India's strength, those who defend Indian civilization, like Swami Vivekananda, Sri Aurobindo, Sri Narayana Guru, have been excluded. Sati was a minor problem. The evangelist Christians have made it a big problem to delegitimize Indian culture. Sri Meenakshi Jain has written a book on Sati. Social reform, in that Sati they have brought it. Ishwar Chandra Vidyasagar is there. Pandit Ramabai. Pandit Ramabai, he was a Brahmin lady converted to Christianity. They have included her. But no space. E.V. Ramasamy Nayakar is anti-India, anti-Brahmin, anti-North, racist to the core. They have included his perspective. But no space to Indian perspective. All anti-India tendencies have got space in this curriculum. And now let us go to the next level of analysis of references. Who are dominating as authors, creators, knowledge providers? When we assess that, we see UK, USA. USA is dominating and UK is UK and US together, the Western authors dominate the trends. India is only 25%. These are mostly again among Indian scholars. We see Eurocentric scholars reproducing Western knowledge. G.R. Banerjee is included, but her ideas are excluded. She says, yeah, dharma is working, not right-based approach is working, but entire curriculum is right-based, radical. The models which have failed, see, in social reforms, in national freedom movement, only culturally rooted models are successful in India. In development, in poverty eradication, in any field of development, social justice. Ambedkar, he was a scholar of Buddhism, Vedantic models, Bhakti models. They only worked. The Western models, including missionary models, radical models, Naxal models, have everywhere failed. And this curriculum is actually promoting the failed models to make social workers failures and get frustrated. You know, this model really induces aggressive approach. You know, it tries to induce frustration, and through that generates aggressive social workers. And again, European no market. It looks India as a market for Western theories, perspectives, authors. So there is something epistemic domination, epistemic inferiority complex, intellectual dependency, inferiority complex, you know, sustaining the Macaulay mentality. It is working. You know, let us move to the next ultimate, you know, the goals and objectives curriculum. When we analyze that, I'm not presenting everything here. You can check that. You know, the perspective is the knowledge. Epistemology is the study of knowledge, the philosophy branch of philosophy that wills what knowledge and how to acquire knowledge, what is valid knowledge. So we have a different perspective of knowledge, which says that knowledge need to be pramana based. Prameya is based on pramana. Pratyaksha, Anumana, Aptavakya, Arthapatti, Anupatti, Upamana. Like that we have pramanas. At least minimum 3 pramanas. Pratyaksha, we have to have empirical proof. And on the basis we can do Anumana. We cannot do directly imagination or Anumana. Most of these Western models are Anumanic, axiomatic. You know, the ethical values were derived from West. And you know, and it sees Indian society as incapable of producing its own knowledge for understanding its problems, difficulties. Only West can understand. India is viewed as not having anything on its own to address its problems. So, Western categories of mind, illness, evidence, all this is there. This is something epistemically Eurocentric. Looking at everything, India's problems, development or health, everything from the Western lens, impose Western historiography on India. Next one. So there is something hierarchy in the knowledge. Western knowledge is considered as superior without adequately debating, discussing, or testing. This curriculum team, the task force has situated the Western knowledge as something superior to all other knowledge. And India is only a context for imposing the Western knowledge. The objective is to impose uncritically Western perspectives on India, critically seeing India from the Western point of view. And it denies us to know our own perspectives and look at the Western theories, perspectives, interventions, our angle. And we are only followers, purchasers, buyers. They are only producers, producer of knowledge, medicine, all that we need to only purchase, follow them faithfully like the believers do. And and it is not that we don't have. We have other non-Western countries have knowledge which are holistic, which are time-tested, but this curriculum, the goal of the curriculum is to not to recognize, to impose the Western one, and train the social workers to see our reality, our problem, our solutions for them from the Western angle. Only social worker is an agency to market the Western psychiatric medicine, allopathic medicine, everything, psychotherapy, Freudian therapy, or cognitive behavioral therapy, existentialist therapy, only, and all our yoga, Ayurveda are only supporting role. We cannot do the main business. Main business is only for American corporations, foreign corporations selling, producing American medicine. Maybe they are having branches here to produce the medicine and sell. So that these choices, the choices are very clear when we look at the curriculum, objectives and goal. They are uncritically accepting the Western model, especially the radical models. But when it comes to India, they want to criticize from the West and within India also. Pandita Ramabai, Ishwar Chandra Vidyasagar, E.V. Ramsamy Nayakar, who was a racist and anti-India, who opposed freedom struggle, Pandit Ramabai. So all that, they are very eager to introduce all those things. And whatever they have accepted also, only the concepts which are akin to their concept they accepted. Seva, charity is not dana. Seva is not service. It's different. The ontological and epistemological foundations, axiological foundations of seva, dana are, and again the essence of Indian civilization is dharma. They have not included dharma in that. See, Indian people are driven by dharma, our responsibility towards our father, mother, family, community, society, not only society, entire ecology and the us, we are responsible. There is a cosmic order called rhythm. So dharma is the overarching framework. This committee, task force, seems to suffer from deep cultural ignorance, deep cultural alienation, and antipathy also, suffers from antipathy. And they try to create social workers, medical psychiatric social workers, who are culturally approved, alienated, and antipathic. So mercenary agents of the West. So very, very dangerous tendency. And when you look at their understanding of India, how do they understand? It is, they are not seeing India as a civilization with rich knowledge, which has made rich contribution to global knowledge, mathematics, physics, astronomy, health, holistic health, well-being, philosophy, all that they are not ready to accept. They are inferior. No, you have full of problems, inequality, everything. All that Western solutions you follow, all this will go. Never. No society in the world has followed West and became rich. Anybody has any proof? Spirituality and one scholar has been spirituality and social work. The idea of spirit, that model spirituality is bio-psycho-social spiritual model is not there. In medical is there, in psychiatric is there. Very different. Our idea of spirituality is different from the West India. Okay. Spirit. What is spirit? Atma Bodha is different from spirituality. Spiritual. Okay? Spirituality and social work. Spirituality, no, we believe in sadhana, not faith. Simple faith. So very deep. What we see is that they are not including. And again, it is ultimately biological, bio model, medical model of social work dominating the curriculum. There is no space. I am asking, I am telling there is no space. The problem is spirituality and social work, no? It's not there. Mimamsa, this Vipassana is not given a space. Buddhist social work is not given space. Jain model of well-being is not given space. Yoga model of well-being, Pancha post model is not there. In Hong Kong, they have produced integrative body-mind therapy. They have not included. You know, there are advances happening in case management, computer-aided case management, ecological systems model not included, ecogram, all those relational tools for understanding the client situation are there. They have not included. Social network models, personal healthcare, community, group level assessment, social networks are there. They have not included. They are much eager to increase the radical content in the curriculum. They have not taken care to include is useful, directly beneficial. They are interested in making social workers ignorant of India. And you know, ignorant of India and not ready to use our own resources. They want to use somebody other's resources, somebody else's perspectives. This is very serious. So again, the idea is destroy what is there here. Family, community, everything. West has not successfully, social sciences, the psychiatric not overcome the problems. These Western models are capable of only coping with the problems, lifelong dependency. These models create, and that's, social workers are just aids to support medicine selling, drug selling, whether for mental illnesses or other illnesses, lifelong illnesses, not actually curing the diseases. And again, the burden on the structure, and again ignoring the global structures, only talking about local structures or national structures. Again, actually deceptive. This perspective is very deceptive. And again, indigenous Indian models are namesake. There is a tokenism, marginalization of Indian knowledge systems. Indian knowledge systems are not part of the core of the curriculum. Their space is denied. Epistemic injustice is there. And this curriculum, the task force served as agency of the white people, multinational corporates, and West, who breed the leftist radical to work for breakdown of India and its institutions, especially family, community, spiritual tradition, everything, as obsolete. These epistemicidal tendencies are there, and this is very serious problem. Unless we change this, we cannot get professional status in India. Let me present Nigamana conclusion. The curriculum is structurally dominated by Western epistemic frameworks. Epistemic means knowledge. Concentrates radical and critical perspectives exclusively within Western ideological traditions, privilege deficit pathology-oriented models. It focuses on the deficits, problems of India, Indian people, culture, society, not recognizing the strengths and wellness approaches, and marginalizes Indic knowledge system to tokenistic and peripheral roles consistently favors these reductionistic fragmented models of healthcare, mental health care. See, it operates within the Western frameworks, and this is good for professional development in India, and it is not good for the mental health of social workers in India. These models, this education will produce social workers who are deeply alienated, ignorant, and frustrated, and they will, rather than India, its people, its utilizing its rich intellectual, moral, spiritual resources to promote holistic well-being, they will serve the multinational corporations, drug sellers, and sustain the global hegemony of the white racists. So this is not good, and this is a deprofessionalizing tendency is embedded in such a curriculum, and we need to reject this. We need to reject this colonialist, imperialist model. And we need to, particularly, this three level, this BS level, MSW level, and again parallel curriculum structure, acceptable. And already colleges and universities are offering, and they don't have resources to offer BSW with medical and psychiatric social work specialization, or medical social work and psychiatric social work specialization. Only medical colleges can offer such and psychiatric super specialty and postgraduate level. So our suggestion is actually to have only to maintain the present status, like after post graduation doing 2-year MPhil like program. MPhil is abolished, means they can 2-year medical social work or psychiatric social work with 1 year as 1 year dissertation and 1 year course. Existing models should continue. And another thing, any national curriculum, social work curriculum, or any subject curriculum in India should recognize India as a living civilization with rich holistic knowledge base, Indic knowledge system. And our knowledge systems, our models, philosophical or contextually derived. Very many health models, mental health models are working in India. We can look at very many development models, social justice models are working here, and the curriculum need to build on the basis of our own basis of the experience, the models derived from the field and derived from our age-old wisdom, rather than uncritically marketing the Western. We are not saying we don't want Western knowledge. No, we can include, but not this radical variety, not this pseudo-scientific variety, not this aggressive variety, not these frustrating perspectives. We don't want that. And that is not, we don't want social workers to become urban Naxals or Andolan Jivis. And this is actually your era, Eurocentricist, colonialist, imperialist, your era is over. All over the world, the indigenous, non-West, decolonial scholars are rejecting these radical leftists who work for aggressively destroying other cultures and people and make culturally alienate, cultural erasing of the culture or civilizational destruction. We need to integrate our knowledge systems to the core, whether well-being, which is the ultimate goal of social work, liberation, moksha. We need to integrate our models of understanding, our experience-based models, and then only social work will go. We are not saying no to scientific approach, systemic approach. Yes, we need. And again, dharma, social workers should recognize, curriculum should recognize dharma as the essence of India's civilization. Whether Vedic, Vedantic, different schools of Saivism, Vaishnavism, Buddhism, Jainism, Sikhism, all recognize one thing, that is dharma as our essence. We need to feel responsible towards our family, community, society, humanity, and entire cosmos, nature also. So that is our wisdom. And without understanding, we cannot work here and we cannot become a profession here. And we not only we say that Indian knowledge system should be given space in Indian social work curriculum, also the perspectives of African people, Chinese people, or Japanese people from Asia, Latin American native people, Australian people, all their perspectives on social work, health, and well-being need to get space. All systems of Ayush need to get space. It's not that only monopoly, medical and psychiatric social work should be monopoly of the allopathy. This is not good. Okay. Thank you very much. Any points are there we can take up? A few points have.
So, Kanagraj,
Sir.
for a very comprehensive and carefully structured presentation, you have clearly outlined the intent, scope, and internal logic of the draft curriculum, which provides an important foundation for the critical academic discussion we are having today. Your exposition has helped us understand the architecture of the curriculum and the considerations that informed its development, which will greatly assist the panel and the audience in engaging with it more analytically. So, I would just provide a summary of the points that you have very carefully crafted and presented. That the draft curriculum gives limited attention to the India's diverse and long-standing social work tradition, which are largely community-based. The curriculum accords disproportionate primacy to a single specialization, positioning the specialization above the general social work, thereby weakening the discipline's foundational social science base. The specialization precedes the parent discipline itself. So, this is a serious issue that should be dealt in by the other scholars as well before this draft is finalized. Overall, the curriculum calls for a careful consideration and restructuring to ensure that the social work education in India remains contextually grounded, as pointed out by you. It should be academically balanced and responsive to the local realities rather than primarily aligned with the imported frameworks from the West, which you call radicalized Eurocentric models. So that is a serious issue that must be, that requires a careful reconsideration. And therefore, it is very important that the medical and psychiatric social work must remain distinct from the general social work education. And the current draft, which includes everything like social development, child development, women, elderly, drugs, and community practices, etc., etc., they should remove and minimize them, particularly the subjects like community organization, social welfare administration, rural and women and youth development, etc., and strictly focus on hospital-based psychosocial assessment, counseling, rehabilitation, and patient advocacy. Without this demarcation, I feel that the specialization loses professional legitimacy and confuses within the larger, broader framework of the general social work practice. So, therefore, it should be limited to the knowledge domains that are required for the hospital settings, and therefore, we must assert that Indian interventions in health and mental health should not be used as cultural footnotes, but they should find a place in the core professional framework. So, having said this, I would now request anyone among the audience or our discussant, Professor Vishnu, to kindly come up on the platform and add his inputs. So it is over to Professor Vishnu for his inputs, please. Professor Vishnu.
Thank you, sir. Sir, Professor Kanagraj has made already a very detailed, comprehensive analysis and critique of the draft medical and psychiatric social work curriculum. And sir, you have also briefly uh, given us the conclusion in a nutshell. What are the major lacunas, major challenges in the curriculum? I just want to conclude, sir. The entire curriculum is against the national education policy because it only mentions the India's knowledge system in a very superficial, symbolic manner. There is no space for India's knowledge system in entirety. It is only promoting allopathic system of medicine, Western system of medical and psychiatric care. It is completely sidelines that Indian uh, well holistic system of mental well-being. And secondly, the references show that around 50% of the references are from America. That means again we are trying to, and around 25% from UK. Again we are trying to promote that again, that Macaulay system of education. And already, sir, we have completed around 9 decades of social work education, and still we are not able to being recognized as a professional. The same kind of blunder we are going to have if you introduce this draft curriculum in the Indian educational setting. The same kind of problem again will struggle. Of course, we will be getting professional licensing, or we can have some, medical, psychiatric, social work council. But ultimately, the skills, our skills, we are not able to develop by using this curriculum. Again, our students who are the product of this curriculum, they will be useless by the society and they will never be considered as a professional. So this is a serious professional challenge, and it will be another great blunder in the history of social work education in India. So having said so, I think the points raised by Professor Kanagrajan and by you, sir, Professor Dipe, sir, is highly relevant, and the curriculum needs to be revisited and needs to be readapted. And Government of India should reconsider in modifying the syllabus according to the needs and culture of Indian society. Thank you, sir.
Sir,
So
one
thank you,
request,
Dr.
Vishnuji.
Vishnu.
One request.
Yes, sir.
What I am asking, Mithilesh sir, please summarize in Hindi.
जी
We
जी
need to promote, and Vishnu will again in Odia. Yeah, I will speak a few minutes in Tamil also. We need to promote our languages.
जरूर, बहुत बहुत धन्यवाद सर. मैं पिछले 1 घंटे 13 मिनट से इस बात को सुन रहा हूं और ये बहुत ही सार्थक बातचीत हुई और अभी के समय के लिए बहुत ही जरूरी बातचीत हुई. एक ऐसे समय में जब राष्ट्रीय शिक्षा नीति 2020 एक समेकित स्तर पर एक ऐसे ज्ञान के प्रसार की बात कर रही है जो भारत एक राष्ट्र के रूप में कैसे विकसित हो उसके बारे में बात कर रही है. और ऐसे समय में इस तरह का कोई करिकुलम फ्रेमवर्क बनाना जिससे हम भारतीयता को लोप करते जा रहे हैं, उसका विरोध एकदम होना चाहिए. और जैसा कि कनकराजन सर ने बहुत ही विस्तार से कहा कि यह बहुत जरूरी है कि हम अपने पाठ्यक्रमों में किस तरह से भारतीय तत्वों को आगे लाएं और जो हमारी भारत केंद्रित दृष्टि है, चाहे वो साइकोलॉजी से रिलेटेड हो, चाहे वो साइकेट्रिक सोशल वर्क से रिलेटेड हो, चाहे वो मेडिकल सोशल वर्क से रिलेटेड हो, उसके लिए जब तक हम भारत केंद्रित मनोविज्ञान और मनोविश्लेषण को इसमें शामिल नहीं करेंगे, तब तक इस तरह के कोई भी यूरोसेंट्रिक, कोई भी जो आधुनिक ज्ञान के नाम पे जो हमें परोसा और थोपा जा रहा है, इसका विरोध किया जाना बहुत जरूरी है. और आज का ये जो सार्थक चर्चा रही, जिसमें डीपी सिंह सर ने भी बहुत विस्तार से अपनी बात रखी, और बहुत ही विस्तार और पावर पॉइंट करेक्शन से तो सबसे ज्यादा कनकराजन सर ने रखी, और बाद में विष्णु सर ने जो अपनी बात रखी। मैं तीनों के प्रति आभार व्यक्त करता हूं और इस बात की कामना करता हूं कि पूरे भारत में इसको लेके एक जागृति आए, और समाजकार के भारतीकरण के लिए जो भारतीय समाजकार परिषद लगा हुआ है और उस पर सतत चिंतन कर रहा है, विचार कर रहा है, और उसको लेके किस तरह से ज्ञान निर्माण किया जा सकता है, उसको लेके बात किया जा रहा है। उसमें ये जो बातचीत अभी हुई है वो बहुत ही जरूरी बातचीत है, और हमें इस बात पर ध्यान रखते हुए इन तत्वों को एक समेकित रूप से इसको लिखना चाहिए, और भारत सरकार को अनुशंसा सहित इस बात पर भेजनी चाहिए कि कैसे हम इन पाठ्यक्रमों में आवश्यक सुधार लाके एक भारत केंद्रित और अभी की जरूरतों की जरूरत, जिससे हम विकसित भारत की जो संकल्पना देख रहे हैं, आत्मनिर्भर भारत की अगर हम बात कर रहे हैं, तो आज के ये जरूरी जो चीज है उसको हम अपने पाठ्यक्रमों में तब तक शामिल नहीं करेंगे, तो ऐसे कोई भी एकांगी पाठ्यक्रमों का हमें विरोध करना चाहिए, और हम लोग निश्चित रूप से पुरजोर रूप से इसका विरोध करेंगे, तभी हम समेकित रूप से एक नया पाठ्यक्रम ला पाएंगे। बहुत बहुत धन्यवाद।
विष्णु वड़िया वड़िया विष्णु
विष्णु जी, प्रोफेसर विष्णु,
वो जुड़ रहे होंगे,
जुड़ रहे होंगे। तो ये जो मिथिलेश जी ने जो सारांश में जो पॉइंट्स दिए हैं ये बड़े ध्यान के योग्य हैं, और हमें इन पे विस्तार से और भी गहन अध्ययन और चर्चा करनी पड़ेगी, क्योंकि ये जो करिकुलम है ये इट इज वेरी एक्स्ट्राऑर्डिनरी, वेरी बल्की करिकुलम, and it is largely, as you said, is not addressing the aspirations of the Indian health realities. In fact, given the fact that the health infrastructure, even the hospitals, they are catering to large number of patients where infrastructure is falling short. There are lack of doctors are there, then uneven staffing is there. There is various other problems in the hospital settings. It is not as clean and as infrastructurally enough and sufficient to address the varied and diverse needs of the Indian people from across various strata, from lower poorer sections, the larger middle class, and so on and so forth. So therefore we cannot actually address these issues by very standardized ways of America, because the societies there is different, because in fact the Indian population is almost 18-19% of the whole world's population. We are supporting such a huge population of the world across across variety of social realities, and you cannot compare this with the USA or Canada or UK, because they are very small countries in that sense. And even one state like Uttar Pradesh itself is having a population equal to the United States, if I'm not wrong. So you cannot have these Western paramedical frameworks and fit them into the Indian situations. It's like cutting the head for fitting the head. So you have to actually alter your head to fit your head, rather than the opposite way of doing the way it is being done. And that is precisely the point that has been highlighted by Professor Vishnu also. If we are not vigilant and we don't take into account the realities of Indian society, the social work profession will have the image that it has today, even after almost 98 years, because we have all not been able to develop that image where the aam admi recognizes you as a social worker. You are actually shouting yourself on the rooftop that we are a profession and so on and so forth, but people at large know that your degree and it doesn't speak what you are speaking. No? So therefore, our skills base, our curriculum itself should define who we are rather than admiring, our own way in our own platforms. Okay, so it is for the society to recognize our skills, and therefore we will have to, introspect now. It is high time. We cannot develop these such curriculums, bulky curriculums, in a very hurried manner without, discussions with various stakeholders, as was pointed out by you, Dr. Kanagraj, that the committee that was formed was, in fact, was not very inclusive and representative also. So it was, the scholars were drawn from, in your words, if I borrow your word, elite schools, no, and that is not fair, because the last man in the room must be addressed and must be included, across the disciplines, across the specializations, in fact, because you cannot, have a specialization which will define the rest of other specializations, like what has been done in this case. So it is like, a son is getting bigger than the father itself. So medical and psychiatric social work is becoming bigger than the social work, general social work itself. So there's a serious issue. So we have to be very careful, and it's not about dismissing them, or it is about ridiculing, or casting aspersions on their competence, but it is about being, addressing serious issues that we face today. As senior academicians, we must, think twice to introspect and find out why we have not been able to gain the professional identity that we should have so far. So this is a milestone, in fact, after this Rehabilitation Council of India, where disability, and then Rural Development Institution Council, where rural development, and now this is about health, specialization in health, etc. So we will have to be very careful, such that the general social work identity is not diluted, and it should remain in a the boundaries must be defined. The professional boundaries must be defined, and we must focus largely on the local aspirations, so that our image, or our identity as a profession is recognized by the man in the the last, standing in the last line. So that is my concern, and it is academically unethical, I should say, that a national curriculum should be, basically be based on the Western models, and based on ignoring the Indian realities and indigenous practice traditions of India, which are very rich, as was pointed out by you in your presentation. So we will have to include everything. We will have to actually broaden our mental outlook, in a way where we should see that Indians' traditions are very open, they are very secular, they are very inclusive, and they don't have that hegemonic outlook to say that we are the one who are superior and rest of others are not superior, and so on and so forth. So India is a very inclusive society. The traditions are very inclusive. They are, as you pointed out, that there are logic systems, then there are various schools, okay, which in fact allow full freedom, even allow falsification. No, there is nothing like which in a way may be branded as blasphemous in that sense. Okay, so we will have to see that the empirical realities of our own health systems are incorporated, and the government must have a relook over the entire curriculum, which has been there on the website, or which has been invited for suggestions from the public. So Dr. Kanagraj, your presentation has been very enriching and enlightening, and very broad also. It touched upon almost all the issues, and it was in fact a great opportunity for me to be there with you on this platform for this on this discussion today. So I don't know now what should we conclude, or should we be waiting for Dr. Vishnu for his comments in Odia? So I don't know.
He's coming.
What
No,
is
sir.
your suggestion?
Comments in ODS are
Okay,
not
Vishnu
required. Comments in
is
ODS
not
are not
required.
required. But if you can have some questions from the audience, from the social work fraternity, I think that will be most helpful. Because Kanagraj has clearly mentioned, sir, everything in detail. That
Okay.
Western theories, Western references, Western knowledge system, Western epistemology, everything, the worldview, the content is Western. So we must strongly reject that curriculum in Indian context. We can have some questions, sir, if our audience
Actually,
feel.
we we have expected lot of questions. Questions are not coming. Social workers in India are not encouraged generally to ask questions, because they are only told about the Western ones. And when we critique West, no, questions are not coming. Probably left people would have not come to listen our discussion. So if they have come, they would have asked some questions from their own perspective. We can conclude. I think we can conclude. My request to Bharatiya Samaj Karya Parishad General Secretary Professor Vishnu is here. Professor DP Singh also is here. Others also are listening from different parts. And this video again will be live streamed in our Facebook pages. Tomorrow and day after tomorrow, one by one, we will live stream. And we are going to generate small clippings, brief clippings from our speeches, our presentation and our other speeches. And we will share everywhere so as to reach everyone. So India is different. And let me say a few words and leave to Vishnu, and last word to Professor DP Singh. So India is not the same. Today India is different. We are in India, Bharat, which is very proud of its rich knowledge systems. We are not the same India which believed that only Western knowledge can liberate it, or Western knowledge only can promote it a developed nation. We are not living in such a India. So, this kind of cultural, this kind of culture destroying, civilization destroying, West imposing, intellectual inferiority complex inducing curriculum will never be accepted. The government of India is not the same. It's different. The government of India is different. And in social work, we are here. Please remember, we are here. Bharatiya Karan advocates are there. And we know your all intentions, your theories, your models. We know very well. And this curriculum is anti-India. I am telling very clearly again, it is anti-India, anti-Hindu. Racist elements are there in this. Breaking India tendencies are there in India. Hindu-phobic tendencies are there in this curriculum. Breaking India fault lines are there in this curriculum. So we have already submitted our comments online. After the date is over, we are now presenting. General public, BSKP, I request BSKP General Secretary to present our views to the ministry, Home Ministry also, because we are government of India is fighting against Naxals. This curriculum promotes urban Naxalism in the name of medical and psychiatric social work. So we are fighting tooth and nail against radical approaches. Radical approaches totally should be excluded. No space to radicals here. Because you deny space to others. You are not open for debate, open for discussions, only imposition, as if you have come from God directly. So we are going to write to ensure that it is thrown to archive, not dustbin. Let it be there in the archive. Thank you very much.
So, would I be inviting Dr. Vishnu for his remarks? Dr. Vishnu, take just
Yes, sir.
1 minute
Yes, sir.
for a vote of thanks
Yes, sir.
to him, and then I will just conclude it finally. Please go ahead.
Okay, sir. Just I want to say one thing that I am in the social work profession for the last 3 decades. I completed a master's in 1996. But in the last 3 decades, not only 3 decades, even in the last 9 decades of social work education in India, still misinformation is there in the minds of the students and the teachers that social work is a profession in India. And the admission students take in the universities and colleges thinking that it is a professional course. But the reality is it is neither professional course nor semi-profession nor even it is a quasi-profession. And I think it is moving towards deprofessionalization of social work education. And in this critical juncture, again, if we adopt that Western Eurocentric medical psychiatric social work curriculum, it will be another blunder. Another thing that I realized that even in the social work fraternity, most of them are not able to distinguish what is India's knowledge system, what is Western knowledge system, because the information they have been provided, the inputs in the books, reference books, it is purely Western. So our India's knowledge system is slowly, completely, it has got sidelined, and we are now moving towards killing our entire Indian epistemology. So I think the Bharatiya Samaj Karya Parishad should strongly resist this curriculum and should make necessary attempts towards Bhartikaran of medical and psychiatric social work curriculum. So on the behalf of BSKP, I request Professor DP Singh sir to propose a formal vote of thanks. Thank you, sir. Sir, unmute करिए.
So we are at the end of this vibrant session, which largely was the brainchild and the idea of our friend Dr. Kanagraj, and he has put in a lot of efforts to do justice to this more than 1.5 hours now, touching upon various issues. And as concluding remarks, I must thank him, and I must thank each one of the audience, also those who have been watching us on the YouTube. I am also particularly thankful to the General Secretary of the BSKP. Our friend Mithilesh ji also has summarized it in Hindi for our benefit and the larger benefit of the other people, those who will be watching this presentation on YouTube in the subsequent days. So this effort of Dr. Mithilesh and others is duly acknowledged by me as the presenter of this session. And this discussion has really highlighted the intent as well as the important questions regarding the disciplinary identity of social work, importance of the contextual relevance of this curriculum, and also the pedagogical feasibility that is required. So the concerns raised are not just about resisting to reform, but about the direction and grounding of the reforms. A curriculum of this scale and consequential benefits from continued academic dialogue and careful reconsideration wherever necessary, so that the specialization such as this gets strengthened without overshadowing the parent discipline of social work. So that is the major concern. It is hope that the observations and the questions shared today will contribute constructively to the ongoing review process of this curriculum and assist the concerned authorities in redefining the curriculum in a manner that is academically balanced, contextually appropriate, and professionally sustainable. I, as the moderator of this panel's discussion, I really feel honored and privileged to thank you once again, each one of you, for your engagement and for your valuable contribution to this important conversation. And I look forward. This was for the first time that this whole, through the StreamYard and live streaming through the YouTube, this is my first experience as such. So in the due course, we will be doing more of such interactions through these technological, platforms that are easily available. And it will be great for others also, so that our views are floated around to all the stakeholders, the students, the practitioners, in the larger interest of the social work profession and practice. So I once again thank Dr. Kanagraj, Dr. Bishnu, and Dr. Mithilesh, and all the audience, those who have been with us this evening. Thank you once again, everyone. Thank you.